Important about it. So
Totally forgot.
Thank you, Vicky. And I was just wondering that Burjot, in your tenure, we have about 50 meetings approx. And we have a big group of illustrious members. And if we need members, you need speakers. I think from our club itself, we can get 50 members to speak.
Wonderful.
So we are very fortunate to have amongst us as a member, Dr. Dilip Raja. When I got his introduction, it was a long list of achievements. So I tried to concise it. So please excuse me for that, Dr. Dilip. Dr. Dilip Raja is a consulting urologist and andrologist for more than 35 years in Mumbai, because 10 years of his life is spent in Dubai practicing. So 35 years in Mumbai. He is a gold medalist and recipient of many scholarships during his under and post-graduating training. Has been trained extensively in his specialty at various renowned centers in the world, like for stone disease in Germany, for microsurgery in Belgium, for impotence and urinary incontinence at Mayo Clinic, USA, and for infertility at Australia. He has done some pioneering work in the field of lithotripsy for kidney stone diseases in India. Has a large number of national and international publications to his credit, has delivered many guest lectures, conducted surgical workshops, and has been instrumental in setting up kidney units at national and international levels. Also, apart from being a member of Rotary, he is a member of almost all the national and international urology associations all over the world. He has done many Rotary camps in urology in East Africa, especially Kenya, Tanzania, Mauritius, Seychelles, and many more. Presently, he is a senior consultant in the field of urology and andrology at the Saifee Hospital, Mumbai, at Lilavati, PD Hinduja, Breach Candy, and Wockhardt Hospital. He has also been practicing, as I told you, urology for the last 10 years in Dubai. We really look forward to hearing Dr. Dilip Raja, who is a good friend to all of us and a wonderful human being. Thank you.
Thank you so much, Abuza, for those kind words. I just will make a small little correction. I didn't practice 10 years in Dubai, but I was like a visiting urologist to Dubai. Like I used to travel every month. So for me, it was like instead of 12 months in a year, it was like a working of 13 years, because I used to go in a month, about 2-3 days to Dubai and kind of come back. So I was visiting back and forth. So I worked over the weekend that extra month in Dubai. So I say about 13 months that I used to work. However, thank you very much for that. And I'm really delighted and to see such a great audience. And I thank Vicky for inviting me to speak at this club meeting. And I'm seeing there are many giants. I see some of my senior colleagues and Lutika and Sirishma and also sitting. For them, it will be a baby talk, sir, but please excuse me because I do not want to make a very high-tech talk for this audience, because this is where probably we want to continue. So it might be slightly boring for you all, but thank you for being here and supporting the talk. Thank you so much. I will try and share the screen now. And we'll have a little bit of a PowerPoint presentation here. Yeah, can you all see the screen? And am I audible clear?
Not yet, we can't see the screen yet.
You're audible, but we can't see the screen, doc.
Okay. Share screen.
थोड़ी देर में आता है.
Takes time or what?
Okay.
I'm the co-host now, so I have to show this slide. I'll go back again and I'll share the screen again. Share screen. Now share which one? This is the desktop. Share here, right?
Yes, we can see now.
Are you on?
Yeah, it's fine.
Yeah, lovely. Thank you so much. Sorry for the delay. So, Already this part has been told to you. What I normally say is that the basic part of it is, I think about 20 minutes, Vicky?
20-25 is fine.
20-25 minutes. Okay. So basically, my specialty is being a urology and andrology, and most of you probably know what the urologists are. They are the surgeons who specialize in the disease of the male and the female urinary tracts, whereas the andrologist may be a new specialty to many of you, whereby this is a spatial science which is getting separated out from the urology, and it deals with the sexual dysfunction and the male infertility. As you have already heard about it, I'm affiliated to this 5 very prestigious institution, of which Saifee Hospital, Lilavati Hospital being my main workstation, and then comes the Hinduja. But I am visiting consultant to all these places. I always tell all my friends that in life, you have to have 3 friends. If you have to select medical friends, you need to have 3 friends. So they ask me who and why. So I said, one has to be the cardiologist, because when your hair becomes gray, and how can I, Yasmin, remove this part from here? Okay. When the hair becomes gray and scanty, and when the specks of the earthy matter begins to deposit in the tunics of the artery, this is the time when we are talking about when the cholesterol gets deposited in the artery and the person gets a heart problem. So I tell them, number 1 is a cardiologist. And when a white zone is formed around the margin of the cornea, that means a cataract. And finally, it's me. He says, because it is at this time that the prostate gland is usually get enlarged and you need help. So you need a cardiologist, ophthalmologist, and a urologist as your lifetime friend. Why is it not going?
Escape karo, sir.
Yeah. Okay. Now, if just to give you a brief idea, which most of you may be knowing, but just to kind of summarize, that the urinary system we are dealing with deals with the 2 bean-shaped organs in the back of the on the upper back where they are located, and from there, which is like a filtration plant. Whatever we eat and drink gets filtered through the kidneys and form urine and comes down to this long tube which extends from the kidney to the bladder, and the urine passes through that, comes into the bladder, and through the urinary passage it's expelled out. So this is basically the urinary system which we deal with, and which may sound very simple, but it can create problems in many cases. This urinary symptoms, people have sometimes the concept, because it starts from the moment you are born until the day you die. You may have a urinary symptoms. Maybe absolutely in children, the moment they are born, one has to examine their external genitals. They have to see that the foreskin is retracted well, and they are kind of both the testicles are in positions or not, and that has to be assessed. If you go back to the younger people, you will find that the commonest symptoms in the younger people comes with the pain in the abdomen, or with the urinary symptoms, which I will describe further as we go ahead. Because overall, if you will see, the urinary symptoms remain the same for almost all the people. Only at the different types of parts of the age, or different types of the correlated symptoms in the investigation will differentiate and pinpoint the diagnosis. So if a person has got a kidney stone, he will practically come like this, and he will say he's got a pain, something like that. So whenever somebody walks into my office with a hand on the side of it, I know exactly from looking at the distance that this is the kidney stone pain. And other common symptoms which we normally get in every individual, for whatever may be the symptoms, whatever may be the disease, by and large is the irritative or the obstructive symptoms. So you may get an increased frequency. One wants to go to the bathroom more frequently. One has to get up a couple of times at night. Sometimes they can't control urination. And if they can't control urination, sometimes even before reaching the bathroom, they may leak out in their clothes. So these are the irritative symptoms. And then when they go to the bathroom, either they take time to start urination, or the urine flow is poor, and they keep on straining while passing urine, and they take a long time to pass urine. At the end of it, they sometimes still feel that they have not emptied their bladder completely. If these are called the obstructive symptoms. I'll correlate them as I move on. Most important symptom is the blood in the urine. Many times, many people ignore this blood in the urine. Oh, because it comes once and then kind of goes away. So they said, I don't need to worry about it. Might have just happened, or I might have probably sweated, or it's heat and whatever it is. But no, once a blood in the urine, it has to be investigated and one must go down to find the cause of it. And while it is that, your urologist probably will ask you a couple of questions, whether it was painful, painless, it was a total urine was bloody, or it was in the initial part the blood came, or the last. Each of these symptoms has a meaning, and it is from your history only the urologist will be able to pinpoint as to what is going on with your urinary system. The stone disease is a very common disease. There are many diseases which comes. I'm going to highlight only by and large the stones and the prostate, and maybe because we have some women looking at it, so I'm going to talk about a little bit of a stress incontinence. So the stones are only a few types. There is a calcium, oxalate, uric acid, cysteine, triple phosphate, and mixed stones. And these are actual stones. These are not the stones which are picked up from the street, but you can see that the white, glistening white kind of thing, they are the hardest stone. This kind of a mushy appearance is the kind of the softest stone. They are calcium oxalate, and the white one could be the cysteine stones. There could be multiple stones or a combination of these things. This big round thing is something like that. It's found in the bladder. So the location of the stone could be anywhere into the kidney, not in the parenchyma of the kidney, but into the hollow tube, which kind of brings the urine down. It may be in the kidney, it may be in the ureter, it may be in the bladder, or wherever. So we may like to know what are the causes. Generally, the diet, most of the people have a sedentary lifestyle. They take a diet which is very rich in calcium, oxalate, or uric acid. Simultaneously, they have a lower water intake, so they have a less urine output. Sometimes a climatic conditions or a geographic distribution, climate in the sense like a heat, or some of the stone belt zone like Rajasthan or Dubai or Gulf countries, whereby the heat is too much and there is not enough of the water intake, or even if the water is there, there is a hard water. This may lead to the precipitation of stone. Sedentary occupation, very rarely they are hereditary. Once you get to know that there is a stone, one has to kind of get investigated. Very basic things will tell you. Simple urine examination or a simple X-ray or some of the simple blood tests, and a sonography is a non-invasive test, will give you a clue whether you have a stone or you don't have a stone. You can do a CT scan as advised by your urologist. Coming to the management of this stone disease, once you have picked up, there are many kind of treatments are available. And today we always say that if the God has asked you to pick up one disease in the urinary system, benign disease, then you have to pick up a stone disease. The reason is because there is a solution, easy solution, practically a non-invasive solution, and probably a 100% cure can be achieved, provided it is attended in time and with a proper expertise at hand. So you have an ESWL, that is an extracorporeal shockwave lithotripsy, which was introduced in India in 1987. There is a machine which is a kind of a lying where the patient lies on the table of it. You can see below the table there is a shockwave, shock head is there, which kind of goes and touches the back of the screen, and the surgeon sits at the remote control and kind of plays like a computer game and kind of delivers the shock waves, which are not actually the shock waves, but they are the sound waves which goes and targets the stone, which is kind of focused on a side screen, and the stone is blasted that way, which subsequently passes out with the urine. If the stone is large and whereby the ESWL is not applicable, and if it is located in the kidney, then we can make a small little 1 centimeter hole at the back of the kidney, kind of drive in this kind of an instrument, and which goes inside, and either we can break the stone with laser or pick up the stone and come out. If it is there in the ureter somewhere along the line, we have a very fine ureteroscopes which can be passed through the ureter, go up to the stone, either pick it up and come out, or we can kind of lace it and make it into a powder, or we can grab it with a basket and bring it down. If the stone is into the kidney and there are multiple stones and the PCNL requires multiple puncture, then we have a newer device now called a flexible ureteroscope. This is like a non-invasive thing which goes down from the normal urinary passage into the ureter, goes up to the kidney and goes into various pockets. If you see that there is a spider-leg kind of a effect which is there in the kidney, and these are the calyces where the stones can go and hide and sit in. With this instrument, we can go into each and every individual ones, and we can pick up the stones and bring them out. Second part, which I want to tell you about it, because I see we have a lot of senior citizens in our club, and the prostate after the age of 50 is the most commonest problem which most of the people would be facing. Prostate is nothing but a walnut-sized gland at the base of the male bladder. It surrounds the urethra and produces the fluid. Basically, the function of the prostate, as we say, is nothing excepting kind of creating the sticky juice just before, at the time of a sexual excitement, or kind of before the sexual act. There is a little wetness which comes. That is the only action of this prostate gland, adding a lubrication to the whole part. Prostate, every man has, women don't have prostate, and the prostate generally starts growing in size after the age of 50. So in prostate, if it is there, what can happen? Either there could be an infection, or there could be simple enlargement, or there could be a cancer of the prostate which needs an intervention. So if you look at this, this is the yellow thing what you are seeing, which is surrounding the urinary passage, is the prostate gland. Now, as the age advances, and as I said, our hairs become gray, this prostate gland also starts increasing in size. It's an aging process more than calling it a disease. When the disease develops into this in terms of infection or a cancer, then it is disease. But otherwise, normally it is an aging process. And what it does, the importance of this is when it grows, it kind of squeezes the urinary passage, which prevents the urine to flow easily from the urinary passage from inside, and kind of cause an obstruction, which causes the back pressure, the bladder wall becomes thickened, and the pressure goes back in acute condition to the kidneys as well. So this is how the prostate enlarges and causes squeezing of the urethra. So here, basically, again, a history gives you a very clear-cut diagnosis. The patient himself kind of walks into the office, giving us an idea as to that he has nothing but a symptom of prostate, if it is a 50 plus. But if the same symptoms are given by a younger person, then we consider a different diagnosis called stricture of the urethra, or any other obstruction, or a weak bladder, or anything, if there is a neurogenic problem involved. So these are the same symptoms which he will get because of the enlargement of the prostate, interruption in the urinary stream, hesitation before passing urination, frequent urination at night, feeling that the bladder is still full, terminal dribbling, and urgent need to urinate, and a weak urinary stream. Any or some of them or all of them may be present. And here the differential diagnosis is done by your urologist. Say, for example, if you simply say you have a diabetes, it could be simply nothing but a diabetes which can give rise to increased frequency, but that could be bladder outlet obstruction, inflammation, neurogenic causes, any mass pressure, or sometimes even anxiety. Suppose if a younger person is there, we have seen a lot of young boys and girls who go for the interviews or who go for some exam, and they're too anxious about the whole process. What is happening? While they are waiting for their turn to come, they keep on going back and forth to the bathroom. So this is related to the anxiety. Similarly, if the person cannot control the bladder and has to rush to it, it could be simple urinary tract infection or stone, cancer, or neurogenic bladder. Any of these things are possible, but diagnosis is not a rocket science in most of the cases. But it is important for you to consult a urologist to kind of understand what's going on with you. Many people ask me a question, like, oh, do I have a prostate gland? So should I have a prostate cancer also in this gland? No, benign enlargement of the prostate is not a prostate cancer. Benign enlargement of the prostate does not cause prostate cancer. They are two separate identities and must be treated separately. So that myth in the mind that if your prostate starts enlarging, you must be having a cancer as well is wrong. However, both the enlarged benign as well as the prostate cancer exist together, and this probably can be differentiated by some of the blood tests, biopsies, and things like that. Before you do the biopsy and things like that, examination by a urologist is important. His experienced finger will put a finger in the rectum, feel the prostate, and they can decide whether they are dealing with a hard prostate or a soft prostate. Hard prostate, of course, represents cancer. There is a blood test called PSA, prostatic specific antigen, which can give you an idea about whether you are dealing with prostate cancer or not. Uroflowmetry is an expensive way of knowing that what is the flow, or a documentary evidence. If you want it, you do a uroflowmetry. Otherwise, the renal functions and the routine urine examination will give you. Urologists, while examining your prostate, will be able to judge whether there is a tenderness is there, whether there is a symmetrical enlargement or asymmetrical enlargement, whether there is a nodularity or softness or hardness. And all these are significant to the finger of the urologist in making an ultimate diagnosis. Next thing comes is a blood test called the PSA. Now, this is a serine protease enzyme found in the prostate specifically. It is secreted by the prostate and it is found in the ejaculate. But in a blood test, when you do that, you can kind of pick up a process. So these are by and large the value. If you have a value of 0.5 to 4, this is very common. Why I'm telling you not to be getting technical, because nowadays with the Google being in the scene, most of the people already know that their PSA is an abnormal PSA. So this is just to kind of recapture it. Up to 4, it is a very low risk of cancer. 4 to 10 is a borderline case where there is a 20% chance of cancer, and more than 10 is 50% plus chance of PSA can also be high because of infections present or because of a very large size of a prostate gland. Sometimes people become negligent about treating the prostate. They say, no, this is aging process. I don't really have much of a problem. I can just, carry on. It's so what if I have to get up 2-3 times? No, it's not an easy thing to take it like that. If it gets complicated, you can form recurrent infection, bleeding, bladder stones, sometimes acute retention or acute bleeding, and in very severe cases, even may end up in a renal failure if one is totally negligent about his urinary symptoms. So I think ignoring an enlarged prostate is not a good idea. Everybody wants to run away from the surgery. Yes, we do treat them with medications as long as we can wait. So people normally, we have 3 methods of treating: either a watchful waiting where we keep them under supervision, or there could be certain drugs which we can help them relieve. And if the drugs also fail, then one should not hesitate to go for the surgery. These are the 2 types of drugs which we use: alpha blockers, 5-alpha. I'm not going to go into technical details of it as to what, because these are not the drugs which you can use for the self-medication and all. And transurethral resection of the prostate with a various type of energy sources, laser and bipolar and monopolar cautery are the technical part again. In a very large gland or in a cancer of this thing, you do either an open prostatectomy, or in a malignancy, you have to do a radical prostatectomy. This is the way we kind of introduce a very fine instrument into the urinary passage, whereby this is the prostate which is here, which is resected, and you can see how a cavity is created. Here, the whole thing was obstructing the bladder neck. This was the urinary bladder from which the urine flow was coming here. This has been removed, and so the passage has become good and open, so the passage of the urine becomes easier. Many times we also add that lifetime modification can help you improvise the symptoms and all, reduce the fluid intake, especially if you have to get up 3, 4, 5 times at night, sleep is disturbed. Reduce your water intake after 7 o'clock, reduce caffeine, coffee, tea, chocolates, watch over antihistaminics, antidiarrheal medications. They all may give rise to the retention problem if it is not being supervised. Just a few touching words about the prostate cancer. Prostate cancer can have 4 stages. One is limited to the prostate. One may have stage 2. It grows up a little more and it can go a little bit outside. Grade 3 goes into surrounding structures, seminal vesicles and other. And grade 4 is the distant spread. If you really catch the cancer at the stage 1 kind of a thing, and maximum at 2, you can practically have 80 to 90% cure rate, even with the surgery and with the proper treatment. It is in the advanced cases, fortunately, it is there. The good part about the prostate cancer is that it is a very slow growing tumor. Later in your life, you detect 60, 70, 80, then the chances of it becoming hurting you. One person can die of any other thing, the heart attack or anything else, but may not die of the prostate cancer. So prostate, again, as I said, when the God gives you a platter that you have to pick up one cancer, you don't have a choice. Whether it's a kidney, bladder, prostate, pancreas, XYZ, always it's a prostate cancer because it has got a cure rate, very, very high, and it has got a very slow growing tumor. So which practically, if the person normally gets after 70 and 75 or something, we practically sometimes don't even treat because they are so slow growing tumors that it doesn't really harm you much. But yes, it is important to diagnose and remain under supervision and surveillance. Radical prostatectomy, as I said in an earlier cases, you have to go for a radical prostatectomy, which is a surgical removal. This radical prostatectomy can be done openly, can be done laparoscopy. This is the kind of an organ. We remove everything from here to here and then join the bladder, urinary passage back to the bladder. It can be done open surgery or laparoscopically or robotically. option is available, radiotherapy. We don't really emphasize too much on this, but robotic surgery has taken place. Our Saifee Hospital has got one of the beautiful robots, and where we feel very happy and proud to use that robo at the Saifee Hospital, which helps us to reduce the mortality, hospital stay, improvement to the patients, and everything in a much more better manner. This is the kind of a robo which you are seeing, and whereby the surgeon sits far away on a console, and the assistant can see it here, and here is the patient lying down, whereby all these various arms are into the, like a laparoscopy, it has been inserted into the patient, and the entire control of these arms is by remote control by the surgeon in the gown. Kidney tumor is another thing, same thing. If you pick it up early when it is limited to the kidney, it has got much better chances of survival. It is also goes through the stage 1, 2, 3, 4, whereby it is localized, little extension outside, more extension outside into the vein or the lymph node, and a distant spread. So if I particularly showed this kind of a diagrams and not shown you the picture, because they could be very ghastly and not a very pleasant sight to look at. Same thing happens in the bladder cancer. This is the actual bladder cancer, what you're seeing on the bottom left of it. And this bladder cancer was removed, and you see the after effect is something like this. There is a scar tissue which you can see, but this is how, again, the bladder cancer goes from 0 to 4 stages, intruding into the muscle, into different layers. And this is the one which finally it goes out of the bladder and shows a distant spread. So it is important that the consultation with your urologist is required to determine what therapy option is the best, whatever the treatment. It is nowadays we get a lot of people who come to us and say, "Doctor, please do laser for me. Doctor, please do this for me." And doctor, please do. I think that's a wrong treatment, and a wrong message is sent, and they don't really understand and appreciate as to what is the best thing for them. Little bit about the female part of it. Very quickly, I will mention it. I know I'm running out of time now. But there is a urinary incontinence, particularly post-menopausal women. Generally in our country, we have suffered from some kind of a urinary tract infection, whereby they keep on suffering. And the best part of our Indian women, they are absolutely expert in suffering. They don't complain. Unless there is an absolutely end up that they are pushed against the wall, then only. And the urinary incontinence could be one of the stressful out of it. The stress part, which is caused by the relaxation of the pelvic floor because of the aging, multiple deliveries, multiple pelvic surgeries and things. And that is where the bladder sags down and the urine leaks out when they cough, sneeze, or laugh. Overflow is when there is a retention, and when they kind of can't retain any longer, and it kind of overflows, like from a tank, how the water overflows. But this is an urge incontinence when they have an infection or a bladder oversensitivity, when they get a sensation and they can't hold it any longer, and before rushing to the toilet, they may leak out a few drops. But it is the middle part which is the most gratifying, and these two, first and the last, can be treated medically, whereas the stress incontinence is the ones many times it requires is surgical, and the surgery has become so simple nowadays that you just have to put up a tape around and lift up the bladder neck, and it's called a TVTO, transvaginal obturator tape, and it kind of lifts up the bladder neck and controls the stress incontinence. We used to do surgeries, which Shiris Bhai probably will endorse it, Bursch operation and things where you literally 2 to 3 units of the blood has to be transferred and all before all these kind of new devices came in. And now it's just a one-day procedure, and the technology has changed the outcome so beautifully well that it is unbelievable. So this is how a tape is passed around the urinary passage and subsequently lifted it up. It's called a pubovaginal sling. So, ladies and gentlemen, it is very important to understand that, when you really need the correct time to go and see a urologist, because what happens is if you get a chest pain at the middle of the night, we all rush ambulance, ICU and whatnot. Heart cries with pain, but the kidneys suffer in silence. Please do not ignore them. Ultimately, bottom line for all urologists to give their patients is a fantastic stream, and this is what the expectation of a patient is, that have a heart. So always listen to a good advice, consult your urologist, don't hesitate. If you have a slight interest of the problem, it is prevention is better than cure, and it's better to be safe than sorry. I'm trying to finish this. If there are any questions, I'll be more than happy to answer. Thank you so very much.
Excellent. Very comprehensive, Dilip Bhai. and you covered all the topics and issues in an easy manner, very easy manner. Thank you. And I will ask the audience for any questions that you may have. Anybody has questions?
President, can I ask a question? I'm Mohan
Yes,
Lalwani.
please. Yes, Mohan bhai.
See Dilip on the line.
Yeah.
Okay, you. So
Manoj, can you pin somebody?
in a lighter way. Hello, can you hear me?
Yeah, I can
You
hear
can
you.
hear me?
I can hear you.
So I said in a lighter way,
Ah.
isn't the best treatment for all these the glass of whiskey in the evening at
Perfect.
7:30,
We'll never
which we are all going to have now.
But only on one condition. You have to have that drink with your urologist, not alone.
Absolutely. We'll do that.
If I may just ask a question which may not be directly connected to urology, but what about, is it safe to have a drink after vaccination or not?
Oh, that's
There have
going in
been
different
mixed
ways.
reviews,
Why
mixed
not?
reviews about that.
Why not?
Like after a few days, or you can have it on the same night or same evening.
No,
I
why
don't-
do you want to? I mean, same night. I mean, there is no hard and fast rule about the vaccination and drinking. There is no kind of a study has been done that you can't. It just doesn't go along well. But whenever you are going through any major procedure, why do you have to? I mean, we are not so desperate that we have to have it on that evening only. We can skip for a day or two and kind of enjoy it as and when we are more stable. Because on that evening, you may get a fever, you may get some reaction, some allergic phenomenon. Why do you want to add alcohol to that?
Yes, of course. I know this was just generally asking.
Yeah, generally, I mean, but if nothing happens, nothing happens. When something happens, everything is blamed on the alcohol. Poor thing.
Right.
Dilip bhai, I have a
Okay.
question.
Please.
I have a question, Vicky. Can I ask?
Yes, please.
Yeah.
Yes, Nitin bhai.
Yes.
Dilip bhai, I'm 71 and it may be embarrassing for many adults or many old people like me at my age to ask this question, but I would want to know that sometimes, like you spoke about the weak stream, frequent urination at night is a thing that I do suffer from because I'm diabetic, but also either because one is so sleepy and tired, one tends to feel more comfortable to sit on the commode and pass the urine. Is that normal or is that very scary? Or...
Nothing wrong. Sitting or standing is absolutely fine, whatever makes you comfortable.
Because, I mean, as a younger person, you would never think as a younger person. But at my age, I mean...
Don't keep on saying at my age. You are still young.
Thank you. Thank you. What I mean is, yes, it happens often. And like in the day, it seems to be fine. But at night, when after 3 o'clock or so, you have to wake up twice. So you have, it's understood that you have had a disturbed sleep. But by the time you are the second time you have got around again at around 5:30, I have to go at least every 2-3 hours at night. Means if I go to sleep around midnight and wake up around 9, which is very late according to my wife's standards, I wake up even later sometimes. But usme 3-4 baar at night I have to go. So once your sleep is disturbed, during the day it doesn't happen, but at night I always feel more comfortable just sitting down to pass.
There's nothing wrong, and if you recall it, many times we hear of the incidences that so and so a senior citizen, elderly person, fell down in the bathroom and fractured. Most of the time they fall down in the bathroom only. And we all hear about those hip fracture and then femur fracture and a neck fracture, which puts them into bed. What is happening? This is, in men, it is either they have a disturbed sleep, the orientation is not clear, number one. Number two, with an elderly age, they lose their balance at night. Sometimes if they've had, in a men or women, whoever, if they've had a couple of drinks, they are even drowsy. And sometimes the disturbed sleep itself disturbs you.
That's
So
all.
you tend to grab onto the things, and it is always wise. There is nothing wrong in sitting down and peeing, sir. Absolutely not.
So, yeah, so means it's not alarming or
No. Only thing is, if you have that many kind of a disturbance of the sleep and all, there are medications you can look into that, which can kind of, instead of 3, 4, 5 times is there, we can reduce it to 1 or 2 times. I cannot make a bladder 16-year-old all over again. But certainly there could be certain medication which, after looking at your overall picture, whether you can be prescribed that medicine or not, and that will, because sometimes some of these medicines cause postural hypertension. Sometimes if you have a large residue, they throw you back into retention. So all that has to be evaluated and then prescribed. So that can certainly be given, and you can be helped with. If frequency and nocturnal frequency is the only symptoms, then chances are that you will do well with the medication only.
Thank you. Thank you.
Yeah.
Thank you, Dilip Bhai.
Anytime, sir.
Okay, can I ask?
Yes, please. Please
Uh,
do.
Dilip, what is supposing you're not passing full urine, you think there's something still urine left in the bladder. What is the harmful effect long term if there is urine left in the bladder?
Say that again.
If you're not passing out complete urine at the time, that means you're going frequently to the bathroom, but you're not passing fully, then the residual urine which is there in the bladder, how harmful is it?
No, it can give you recurrent urinary tract infection. And that
Pardon me?
urine, if you don't attend, that becomes the seat of infection. Any accumulate, it's like if you look at on the street, there is a puddle around, which is not being drained or which is remaining all the time. Then it becomes a seat of infection. Same thing in the bladder. If you constantly keep on leaving urine behind, urine is a very fantastic source of organism to grow. Bacteria to grow there, and E. coli is one of the being very commonest one. So you will, what happens is that you get a UTI. Now your main cause, what happens is that we treat your infection, so we are treating the effect. You have not even looked at the cause as to why there is a residual urine. Is it your prostate or is it something else? So if you remove the cause for your residual urine, you possibly will get rid of your recurrent complications and symptoms as well.
And what is the long-term impact of using Urimax? For increasing the flow, sometimes doctors prescribe Urimax.
Urimax is a very good drug for the elderly people, and especially with those who have more of an irritative symptoms. It kind of relaxes the muscle tone, allows you to pass urine more freely. It has got only one side effect, is that it disturbs your erectile functions or ejaculatory disturbances. But that
Sorry,
is
I didn't get that. What is side effect?
Ejaculatory disturbances you may have, or you may have some erectile dysfunction. You may not have, but ejaculatory dysfunction for sure. And that is the reason this prostate, any medication or surgery, we don't do it younger than 50 years of age, because by that time people have finished their family plannings and all that. Suppose somebody comes at 40, we don't give this drug, because they some of the old people who have wanting to get married late in life, who get married at 40, and they want to have children. So then they will have issues. So basically, the ejaculated disturbance. Some of these drugs, Urimax, can give postural hypotension. So if you are taking some medication for your hypertension, and this also you are taking, you may suddenly, when you are lying down to standing up or sitting up to standing up, you may suddenly find a drop in the blood pressure. So you may experience sometimes a giddiness and a dizziness. And that's when the fall happens. And the total, if you fall, then the total attention goes more towards your fall and the fracture and all that. People don't realize that the cause was here somewhere else.
Yeah.
So the same thing. It's like you get into retention, or then because of that constant straining at urination, if you get a heart attack, which is very common. So the entire focus goes on the heart attack and the bypass surgeries and whatnot. People forget what caused it. So I think looking into the cause is important, and rather than just depending all the time on the treatment part. Remove the cause, you may get rid of the medical part of it.
Okay, next question. Does anybody have a question? I think, please go ahead if anybody has a question. I think,
Me.
yes, Sunil Doshi.
Yeah, doctor,
Ah.
is it possible that you can reduce prostate by with drugs
Yep, there is a
or
drug,
prescribed drugs?
right? There is a drug.
Prescribed drugs?
Earlier people used to use finasteride. Now it has switched over to dutasteride. But you have to remember, it's not general for each and every patient. Only if your prostate is over 50 grams, you prescribe this drug. So if you have 20 and 30 grams of prostate, there is no point trying to shrink it further. Something which is shrunk, what will you shrink it further? So if you have 100 gram of prostate, then you can kind of give this kind of a drug. Only thing you have to remember is the effect of these drugs do not come before 3 months. So these are long-term therapies. And more importantly, what I normally say, it's never the size of the gland that matters. It is the kind of an obstruction which it causes to the urinary symptoms, which needs to be looked into. You may have 100 gram of prostate and you may not have any symptoms. And you may have 20 gram of prostate and you may have a lot of obstructive symptoms. So what causes, where is the enlargement and where is the squeeze occurring? That is what is important, and that is what will possibly call for a treatment. But yes, if you have a enlarged gland which is very large, you can use this drug, dutasteride, to kind of reduce or shrinkage of the prostate gland can happen over a period of long.
Thank you. Also, another question that supposing you have prostate and you have 20 grams or 30 grams and you do not treat it, is there a kickback into your kidneys and will that damage the kidneys
Again,
in the long run?
how bad is the obstruction?
Yeah.
It depends on how bad is the obstruction, how much residue you are leaving behind, how much is the straining you are putting it, how much is the back pressure going to the kidneys. We have seen where even the kidneys failing also at times. And the infection can go travel back and you can get pyelonephritis, infection of the kidney to the kind of a failure. Anything can happen. Urine that way is the bladder is a very obliging organ, but at the same time when it becomes nasty, it can really create havocs, definitely.
Okay, thank you.
Yeah.
Next question. I am
Nitin Bhai is asking
you're
what
on,
he has.
Nitin, you're on mute. Can you unmute yourself?
Oh, I'm sorry. Okay. May I ask one more question? Dilip Bhai? Yeah. How often or should one do an ultrasound after a particular age, or should one consult you first before doing an ultrasound, or are there any symptoms that
is
may...
non-invasive test, so there is no harm done.
No, what I mean is, are there any indications that I need an ultrasound now?
No, like routine health checkup if you are going. Suppose, for example, if you do at your age, suppose if you want to go for a yearly checkup.
Okay.
You're going for a health checkup program where you do your blood test, you do ECG, you do your chest X-ray. Ultrasound can be a PSA blood test, ultrasound. This could be part of your health checkup. But if you have nothing, you don't need to go for an ultrasound checkup. If you are symptomatic somewhere, then yes, because that is the easiest way to pick up any intra-abdominal problem. But if you have no problems,
last one I had was like in 2019, 2020, and up to 21. As you know, the situation, one is a little skeptical, although there are no complaints, but just not had it for 1 year, 1.5 years. So is that
routinely, religiously, you don't have to go. If you have issues, then yes.
My question was that I have no issues.
No
issue.
Then the only thing is what you said, your urinary symptoms, what you may have a little bit is just an irritated, nothing obstructive. Then possibly they can be simply looked into it. And in that case, before starting any medication, an ultrasound may become necessary.
Okay. Yeah. Thank you.